Hello and welcome to another episode of the American Academy of Research and Academics podcast. I'm your host, and today, we're diving into a topic that many doctors either love or dread, but one that's absolutely essential in modern medicine. We're talking about epidemiology and biostatistics. Now, before you roll your eyes and think, oh no, not numbers and statistics, let me tell you, this knowledge can make or break your ability to provide evidence-based care. In this episode, we'll break it all down in simple terms. What epidemiology and biostatistics actually are, why they matter to you as a doctor, even if you're not a researcher, and how they can impact your career, patient care, and even your residency applications. Alright, let's start with the basics, because before we talk about why epidemiology and biostatistics matter, we need to be clear on what they actually are. I'll keep this as practical as possible. No boring textbook definitions here. Instead, let's break it down in a way that makes sense in the real world of medicine, hospitals, and patient care. So, let's begin with epidemiology. Epidemiology is the study of diseases and health outcomes in populations. Think of it as the science of who gets sick, why they get sick, and how we can prevent or control disease. It's not just about tracking infectious diseases, though that's a huge part of it. It also applies to chronic conditions, cancer, mental health disorders, and even lifestyle diseases like obesity and diabetes. Outbreak investigations in hospitals. Let's say you're working in a hospital, and suddenly, 5 patients in the ICU develop a mysterious infection. Where did it come from? Is it spreading between patients or did each patient contract it separately? Is a contaminated medical device to blame? Should we quarantine affected patients? Epidemiologists step in here. They analyze patterns, trace the source, and recommend interventions, which could be as simple as changing hand hygiene protocols or as drastic as shutting down a hospital ward. One of the biggest challenges hospitals face is hospital-acquired infections, HAIs, like C. difficile, MRSA, and catheter-associated infections. Epidemiology helps track infection rates, identify high-risk units, and implement infection control measures like better antibiotic stewardship or stricter disinfection procedures. A primary care doctor might notice that more and more patients in their community are developing diabetes at a young age. Epidemiologists would step in to analyze. Is it due to diet and lifestyle changes? Is there a genetic factor in this specific community? Is there an environmental exposure, maybe something in the water supply? Their findings could lead to public health interventions like nutrition education programs, policy changes, or better screening guidelines. Alright, now let's talk about biostatistics, because if epidemiology is about asking the right questions, biostatistics is about getting the right answers. Biostatistics is simply the mathematical backbone of medical research. It's the tool that helps us analyze clinical trial data to see if new treatments actually work, compare patient outcomes between different groups, predict disease trends based on existing data. Let's get into some real-world examples of how biostatistics is used in hospitals and medical practice. Making sense of clinical trial results. Imagine you're a doctor, and a pharmaceutical rep walks into your clinic with a shiny new drug for high blood pressure. They say, this drug reduces the risk of stroke by 40%. You should prescribe it to all your patients. Sounds impressive, right? But if you understand biostatistics, you'll ask, how many patients were studied? Was it a large randomized controlled trial or a small study with 50 people? What was the absolute risk reduction? If the original stroke risk was 5% and the new drug lowers it to 3%, that's a 40% relative reduction, but only a 2% absolute difference. Were there any conflicts of interest? Was the study funded by the same company that makes the drug? If you don't understand biostatistics, you might just accept the marketing hype, but if you do, you can critically analyze the data and make the best decision for your patients. White heavy checkmark interpreting medical test results, false positives and negatives. Let's say you order a PSA test for a patient to check for prostate cancer. The test comes back positive. Should you immediately tell the patient they have cancer? No. You need to understand sensitivity and specificity because PSA testing has a high false positive rate. Biostatistics helps you interpret whether you should order further testing, like a biopsy. Wait and retest later. Reassure the patient that the result might not mean cancer at all. Survival rates and prognosis estimation. If you work in oncology, ICU, or any specialty dealing with serious diseases, you often have to answer the toughest question. Doctor, how much time do I have left? Biostatistics helps you analyze survival rates based on historical patient data. It allows you to say, based on data from similar patients, the 5-year survival rate is around 70%. With treatment, you have an 80% chance of remission. These numbers aren't just pulled out of thin air, they come from biostatistical analysis of thousands of patients. Hospital quality and performance metrics. Hospitals use biostatistics to track mortality rates, complication rates, readmission rates, and patient satisfaction scores. If a hospital sees a higher than average mortality rate after a certain surgery, they use statistical analysis to identify if there's a systemic issue, like a procedural error or lack of post-op monitoring. Compare their outcomes to national benchmarks. Now, I get it. Some of you might be thinking, I'm not a researcher. I see patients, prescribe medications, and follow guidelines. Why should I care about epidemiology and biostatistics? Well, let me break it down for you. Understanding these concepts can make you a more effective, confident, and credible physician. It's not just about crunching numbers, it's about making smarter clinical decisions, protecting your patients from misinformation, and even advancing your career. Let's go through 5 key reasons why every doctor, including you, should care. By the end of this, you'll see epidemiology and biostatistics in a whole new light. As a physician, every treatment plan, diagnostic test, and medical decision you make is, or at least should be, rooted in evidence-based medicine, (EBM). But let me ask you this. How do you know whether a new drug, surgical procedure, or screening test is actually effective? You look at the research, right? Clinical trials, systematic reviews, guidelines from organizations like the CDC, WHO, or the USPSTF. But here's the catch. What if the study you're reading was poorly designed? What if the researchers manipulated the data to make the results look better than they actually are? What if the study population was too small or not representative of your actual patients? Let me give you a real-world example. A while ago, a study came out claiming that vitamin D reduces COVID-19 mortality by 60%. Sounds amazing, right? People rushed to stock up on vitamin D supplements. But when you dig into the study, you realize the sample size was only a few hundred patients, not nearly enough to make a broad recommendation. The study wasn't randomized, meaning there could be bias in which patients received vitamin D. Other factors, like overall health, nutrition, and pre-existing conditions, weren't controlled for. Every study has some level of bias, whether it's selection bias, publication bias, or funding bias. Selection bias occurs when study participants don't reflect real-world patients. Publication bias happens when only positive results get published, hiding negative findings. Funding bias means pharmaceutical-sponsored studies may be designed to favor their drug. For example, a study once claimed opioids weren't addictive for chronic pain, funded by an opioid manufacturer. Many doctors believed it, leading to widespread prescriptions and fueling the opioid epidemic. If more physicians had critically analyzed that study's funding and design, we might have avoided one of the biggest medical crises in history. Understanding bias isn't just theoretical, it has real consequences. For my medical students and IMGs out there, residency programs love applicants who understand research. Why? Because it shows that. Heavy checkmark, you think critically. Heavy checkmark, you understand evidence-based medicine. Heavy checkmark, you can contribute to the academic environment of the program. Even if you're not going into research-heavy specialties like internal medicine or oncology, every residency program values doctors who can interpret studies, contribute to quality improvement projects, and analyze patient outcomes. It makes you stand out, and in competitive specialties, that can be a game changer. Now that we understand the importance of epidemiology and biostatistics, let's talk about how to use this knowledge in real-world medicine. Most of us skim research papers, but the abstract does not tell the full story. A study might claim new drug X reduced mortality by 40%, but was it a randomized controlled trial or just observational? Did it include a diverse patient population? Example: doctors widely prescribed hormone replacement therapy for heart disease based on an observational study until the Women's Health Initiative randomized controlled trial proved it actually increased cardiovascular risk in some women. Lesson: always check the methods section before trusting a study. Guidelines constantly change as new research emerges. Example: tight glucose control. Keeping HbA1c below 6.5% was once the gold standard for diabetes, but the Accord study later showed it could increase mortality in some patients. What to do? Look at the evidence behind guidelines. Are they based on randomized controlled trials, observational studies, or expert opinions? Stay updated, and adaptable medicine is not set in stone. Medical knowledge evolves. What was standard practice 10 years ago may be outdated today. Examples: we thought stress caused ulcers until H. pylori was discovered. Opioids were considered safe for chronic pain until the addiction crisis proved otherwise. Vitamin C was believed to prevent colds, but studies showed little benefit. How to stay updated. Follow medical journals, research-based podcasts, and ongoing studies. Engage in discussions and debate new research with colleagues. Stay open-minded and be ready to update your knowledge. A great doctor is not the one who memorizes the most, but the one who keeps learning, questioning, and evolving. If you found this episode helpful, share it with colleagues and leave a review. Want to dive deeper? Check out our courses at aaracademics.com. Until next time.